everyone. My name is Wendy Vazquez, and my pathology report is on HIV and the body. People get sick for several reasons. When someone is sick, it is usually said that they have a virus. HIV is a virus that affects the immune system. HIV stands for Human Immunodeficiency Virus. Over 40 million people have died from this disease since the beginning of the epidemic, which began in the early 80s. Normally, your body fights a virus and infections by producing white blood cells. White blood cells are like your body's security guards and maintenance workers. They fight bacteria to get rid of the garbage in the body to keep a clean environment. HIV, however, destroys white blood cells. By inserting instructions into a person's DNA, it affects the white blood cells called T cells, the helper cells. It is considered a retrovirus because it works backwards from the way human cells do. A message, such as RNA, is sent from the DNA to make building blocks for the body. Retroviruses have their instructions written on RNA. A retrovirus invades your cells and changes its RNA to look like your cell's DNA's instructions. Then, your cell responds as though the virus's commands are its own. In common viruses, symptoms usually start off subtle and then increase until the virus reaches its peak. After a few days, as the body fights the virus, the symptoms gradually and slowly go away and one starts to feel better. When the HIV virus begins, it has similar symptoms of a regular virus that includes fevers, chills, sore throat, muscle aches, rash, and even mouth sores. HIV has stages as well. However, these stages can be slightly different and misleading. There are 3 stages to the HIV virus. The first stage is called acute HIV. During this time, many people, unless tested and confirmed to have HIV, don't realize or think much about being sick because of common symptoms of other viruses. Between the first stage and the next stage, years can go by and symptoms can disappear altogether, but the unseen damage is slowly destroying a person's ability to stay healthy. The second stage is called the chronic stage, clinical latency. This second stage can be very misleading because of the lack of symptoms. As time goes on, however, the virus begins to break down a person's immune system and attacks organs and disrupts normal and healthy functions that maintain homeostasis. Though unseen, as the disease gets stronger, the infected person becomes weaker. During this stage, one can feel well but spread the disease to others. This is the stage where transmission of the virus is at its highest. The third and final stage is called AIDS. AIDS stands for Acquired Immune Deficiency Syndrome. Some call this part of the virus full-blown AIDS. The difference between HIV and AIDS is that HIV is the virus and AIDS is the condition caused by the virus. During this stage, the immune system is so weak that even a tiny germ or cold can cause severe infections and many times lead to death. Where normally a person would fight off a germ or a bug in a day or two, the immune system of a person with AIDS is compromised and too weak to fight. At this stage, the body has succumbed to the effects and destruction of the disease, and in most cases, death is almost certain. Physical changes are visible and a person looks very sick and frail. Massive weight loss, discolored skin, loss of hair, teeth and nails, and even sores throughout the body. As an infected person's energy and strength deteriorate, it is evident that the person is dying. There are many misconceptions about how one can get the HIV virus. When HIV began, people were afraid of getting AIDS because so little was known about the disease. It was thought it could be transmitted by kissing, holding hands, hugging, and sharing a plate of food, and even using the same toilet. As scary as the disease is, you cannot just get it from being around a person with the virus. Medical and scientific evidence has taught us that the HIV virus is transmitted through bodily fluids like blood, semen, vaginal fluids, rectal fluids, and breast milk. Access and exposure to these fluids happen primarily through unprotected sex, sharing needles, or broken skin where blood is present in a person with the virus, as well as during pregnancy, giving birth, and breastfeeding. In 1985, the U.S. developed a test that could identify if a person had the infection even before they had symptoms. In 1987, breakthroughs in medicine occurred. To date, there is no vaccine for HIV. However, a glimmer of hope was provided by the antiretroviral medication azithromycin, AZT. Today it's known as zidovudine. It was designed to extend the lives of those with HIV. It was also discovered that if taken while pregnant, it might stop mother-to-child transmission of HIV and AIDS. The combination of many medications, including a recently created family of antiretrovirals called protease inhibitors, was a groundbreaking treatment in 1996 with the launch of highly active antiretroviral therapy known as ART. Former basketball star Magic Johnson announced he was diagnosed with HIV in 1991. In 1994, Magic started a cocktail, then experimental drugs, which gave him a jump start on a successful treatment regime before the world had access to one in 1996. AIDS-related fatalities in the U.S. decreased by 47% when ART was introduced. Here are a few pictures of the results of people on ART treatments. Several new therapies made it possible for people to take fewer pills, including one pill that combined multiple medications. As just explained how viruses attack the body, we talked about DNA and RNA. Two of the enzymes that HIV utilizes to propagate itself are the ones that the drugs target in order to operate. The first enzyme is known as reverse transcriptase, converts the genetic instructions of the virus, which are encoded on a single strand of RNA, into double-stranded DNA. HIV has classified as a retrovirus because of this manner of reproduction, making antiretroviral medications necessary. The second enzyme is known as protease. It disassembles the protein made by our hijacked cellular machinery to make fresh, useful HIV particles. When taking the right regimen every day, most people living with HIV can see the numbers of virus particles in their blood become undetectable. A low viral load count is not only effective in preventing HIV and AIDS symptoms, but it also reduces the risk of a randomly mutated virus emerging that is resistant to treatment. Furthermore, a low viral load severely reduces the risk of transmitting the virus to others. According to HIV.gov, global statistics, the vast majority of people with HIV are in low and middle income countries. In 2021, there were 20.6 million people with the virus, 53% in Eastern and South Africa, and 5 million, which is 13%, in Western and Central Africa, 6 million, which is 15%, in Asia and the Pacific, and 2.3 million, 5% of Western and Central Europe and North America. Many of the countries hardest hit by HIV also suffer from other infectious diseases, food insecurity, and other serious problems. A sad statistical fact is that wealthier countries have more access to treatment medications because they can afford them, and in poorer countries, HIV infection numbers are much higher due to the lack in finances and access and treatment medication. An article on HIV.gov called Global Statistics states that the U.S. Presidency Emergency Plan for AIDS Relief, called PEPFAR, is the U.S. government's response to the global HIV/AIDS epidemic and represents the largest commitment by any nation to address a single disease in history. By improving global risk prevention, detection, and response, it has enhanced global health security and protected the borders of the United States. Among other global results, the plan has provided HIV testing for services for more than 50 million people in the fiscal year of 2021, as of September 30th, 2021, supported life-saving art and nearly 18.96 million men, women, and children. It also has enabled 2.8 million babies to be born HIV-free to parents living with AIDS. The National Institutes of Health also represents the largest public investment in HIV and AIDS research in the world. It conducts research around the world to understand, diagnose, treat, and prevent HIV infections and its associated conditions, as well as to finding a cure. Treatment options for HIV have made tremendous progress since the first reported cases nearly 40 years ago. What once was a death sentence is now a sickness with hope for longevity of life and normalcy. It has been 30 years since Magic Johnson was diagnosed with HIV, and he is living a healthy, symptom-free life. Countries around the globe need to continue working together on affordable solutions for those who are at risk and in need. With the advancements of treatments thus far, there is hope for a cure one day.